Dacryocystitis, inflammation of the lacrimal sac. Dacryocystitis is an inflammation of the lacrimal sac, a common condition affecting individuals of all ages. It is typically categorized into two forms: congenital dacryocystitis and dacryocystitis in adults. Congenital dacryocystitis. Etiology. Congenital dacryocystitis is usually caused by a membranous blockage of the nasolacrimal duct or a failure in its canalization. Clinical features: epiphora, watering of the eye, and mucopurulent discharge are common symptoms. The lacrimal sac may be slightly distended. Treatment: massaging the lacrimal sac region and frequent instillation of antibiotic drops are often effective. Probing of the lacrimal passage may be necessary in some cases. Dacryocystitis in adults. Acute dacryocystitis. Acute dacryocystitis is an acute suppurative inflammation of the lacrimal sac, often preceded by chronic dacryocystitis or infective conjunctivitis. Severe pain and swelling. Redness of the sac region and eyelids. Tenderness and enlargement of lymph nodes. Chronic dacryocystitis. Chronic dacryocystitis is more common than acute dacryocystitis and occurs following obstruction of the nasolacrimal duct due to chronic inflammation. Epiphora. Conjunctival hyperemia. Swelling of the sac area. Treatment of dacryocystitis. Acute dacryocystitis. Local hot compresses, systemic NSAIDs, topical antibiotic drops and ointment, and systemic antibiotics are used to manage acute dacryocystitis. Chronic dacryocystitis. Probing the nasolacrimal duct and syringing the sac with antibiotic solution are common treatments. Surgical correction may be necessary in some cases. Epiphora, excessive watering of the eye. Etiology. Epiphora can be caused by overproduction of tears or an obstruction to the lacrimal ducts. Clinical features. Excessive watering of the eyes and overflow of tears onto the face are characteristic symptoms. Treatment. Treatment involves addressing the underlying cause of the epiphora. Blepharitis, inflammation of the lid margin. Type. Characteristics. Etiology. Squamous blepharitis. Small white scales at the root of the lashes. Metabolic disorder, often associated with seborrhea. Ulcerative blepharitis. Yellow crusts at the roots of eyelashes, swelling of the lid margins, falling of eyelashes. Infective condition, commonly caused by Staphylococcus aureus. Clinical features of blepharitis. Itching. Intense itching is a common symptom of both squamous and ulcerative blepharitis. Swelling. Swelling of the lid margins is characteristic of ulcerative blepharitis. Redness. Redness of the lid margins is a common feature of both types of blepharitis. Watering. Watering of the eyes is a common symptom of both squamous and ulcerative blepharitis. Treatment of blepharitis. Softening and removal of crusts. Crusts can be softened and removed by bathing with warm 3% sodium bicarbonate lotion or hydrogen peroxide. Management of seborrheic dermatitis. Associated seborrheic dermatitis and dandruff need special care and should be managed by medicated shampoo. Antibiotic therapy. Local and systemic antibiotics should be used to treat the infection. Treatment of complications. Complications such as mydrosis, tylosis, and trichiasis should be addressed appropriately.